Well, good morning, everyone. How are you feeling?
Good morning.
Well, welcome to Zoomtopia. This is great. I mean, I'm sure there's a lot of people that traveled from, from afar. So we really do appreciate you coming over. Like Eric said earlier this morning, that this is about you. This is about our customers. That we're truly grateful for you, for your support, for continuous support, and your feedback that helps us improve our product. And this is basically day in and day out. This is what we do. My name is Mila Krivoruchko. I lead product at Zoom. And specifically, I focus on building our chat solution. A lot of people know Zoom as video conferencing solution, but now, since we're getting bigger, we're expanding into other product lines, and messaging is one of them. It's not a new product in the enterprise space, right? Internal communication is extremely important, and chat is just one of those tools that can help make it better. And most recently, with all the computing getting faster and a lot of cloud solutions and mobile phones, it's become a lot easier to communicate with your coworkers on mobile phone, on desktop, and through other mediums. So communication is a lot more effective. And Rich is going to tell us more about it. Specifically, we wanted to tell you how Genesis Healthcare uses Zoom chat. And I'd like to introduce you to Richard Castor.
Good morning.
Rich is the CIO of Genesis Healthcare. He is he's been with the company for impressive 18 years. That's amazing. And overall, he has about 45 years of experience in healthcare. So, Rich,
Great.
I would like to
Thank
ask
you.
you a question. What is Genesis Healthcare all about?
We're just going to use a few slides to start, just to give you a little bit of a profile on Genesis. Genesis is the largest post-acute healthcare provider focused around skilled nursing services in the U.S. We have 71,000 employees across the U.S. Landscape and care for roughly 300,000 patients per year. We have principally two product lines. The first is, as I mentioned, was sort of skilled nursing operations, where we provide both long-term care as well as short stay for those that come in and do rehab and go home. We operate 470 plus skilled nursing facilities in the U.S. And across 30 states. Our second product line is therapy. So it's physical therapy, speech, occupational, respiratory. Again, second largest provider in the therapy space, operating a little over 1,500 locations throughout the U.S. And across 47 states. We have a very large post-acute physician dedicated team of about 500 physicians and nurse practitioners. Again, providing exclusive services inside of our skilled nursing facilities, and a very, very small staffing operation called Career Staff. Our core values, as you can see on the next slide, are really fundamental to how we operate day to day and provide patient-centered care. And a few elements on this slide I'd like to highlight. Certainly one is teamwork, but the other is creativity and innovation. And those were critical to us as we were looking at how do we up our game relative to collaboration technology. So again, great to be here. It's nice to see everybody.
That's, by the way, an incredible scale. This is just mind-blowing. It's easy to, just by looking at this map, it's easy to understand how effective communication is critical for your company, and definitely a challenge.
Yeah.
How did your company solve it over the years?
I mean, traditionally, probably like many of you and your businesses, I mean, we started in sort of more isolated solutions initially. Obviously, we use the messaging within our medical record systems because that's really what our clinicians live in and day out in terms of as they're providing care to our patients and customers. But on top of that, obviously, email was huge, voice, mobile communications. We used AT&T audio conferencing for audio conferencing. We used Adobe Connect. And for those of you who've been around a while, a product called Breeze way back in the beginning for web conferencing and for training. And then we tried, I think, to use a product called Video with a Y for video conferencing. So the challenge was probably obvious since I listed all those that way, which was they're completely siloed and isolated, not integrated. Is it tight? And probably the biggest challenge was as we were trying to connect people across all those dots on that map, was that our clinical team was struggling with how to use some of the products. The clinical team is really our product. That's our product, is the care they provide. So.
That's incredible. And how did you land on a chat solution? Why did you start looking for it?
Okay. So there's a little bit of connection back maybe to Eric. So we got started. I'll have to be the first to admit I never heard of Zoom. I don't know if anybody else in the room had that same situation, but we actually got started when we decided in 2015 to put our toe in the water in mainland China. So the government asked us to come in and start to introduce post-acute care services to the China population and landscape. And one of the challenges we had, since post-acute was new to that sector, was how do we develop and mature the skills of the workforce that we would need to service patients in our buildings. And so we were starting an online academy. It's called the GRS Academy. And one of the things that we needed to do was to have a blending solution for training that allowed us to have instructors in the US as subject area experts, instructors in China, and essentially students, if you will, future employees that would all be in China speaking Mandarin. So a huge challenge for us. And so we went to market and figured out, well, gee, how could we make this work? And we ran into Zoom. So we started an evaluation in Zoom in 2016. And as we were going through the evaluation, we said, this is really pretty cool. We should use this for our US operation. And so it very quickly expanded to not only finding a solution for China, but also the US.
That's great. So Zoom works, it connects borders, not just people.
It did.
That's amazing.
It was really the only one that did, actually.
That's awesome.
So that's great.
And I'm curious, what evaluation criteria did you use when you went through? I'm sure there are multiple options that you considered before landing on Zoom. So we did,
for us, the collaboration platform was really, in solving our sort of siloed solutions was really critical. So, so obviously we were looking for a solution that handled meetings and webinars and telepractice and, room integration, chat, as well as, I'm trying to think of maybe one more, as well as our blended learning solution. In one platform, rather than, I think some of the other products in the marketplace that we evaluated, you'd use this version of their product for meetings, but if you want to do webinars, you use this version of the product. And if you wanted to do chat, well, you used yet another version of their product. And so really critical for us was looking at all the functionality our clinical team and our business needed and finding it delivered through one integrated product. So that was key. But we looked at everything else, performance, financials, networks, support, quality of the video, quality of the audio. So we really looked at cost was an important factor. So we looked at really all the factors.
Thank you. That's great. Yeah. And I have a question to the audience, actually. Do we have anybody from healthcare industry? So for those of you in the healthcare industry, you probably know that it's heavily regulated, right? The communication is heavily regulated, and a lot of our healthcare customers have concerns using Zoom chat specifically. Did you have concern when you started using Zoom chat, and how did you think about it?
Yeah, we never really had a major concern. We had piloted different texting technology or chat technology back in 2015 from, if you will, what might be considered a competitor to Zoom at this point. But we had used that pilot, and we worked through a lot of the operational challenges, as well as the legal concerns, as well as things like chat retention and such. And so we sort of had already worked through a lot of those decisions. So when we came to implementing Zoom chat as part of our Zoom deployment, we didn't really have those hurdles, if you will. And so that was really great. So.
And is there any specific benefit that you get from Zoom chat that, let's say, you don't get from iMessage or other?
Well, the big thing for us, there was 4 or 5 features that were really key for us. I mean, there's a lot, and Mila could certainly go through all the features of the product, but certainly one was we needed the end-to-end encryption as a healthcare provider. One of the things that our clinical team was obviously going to share was patient information, right? They need to engage, let's say, this therapist with this nurse and this physician. They're talking about the care for this patient. What can we do to improve their outcome? So at the heart of what we do, 71,000 people, is share very, very sensitive data that we have, both a personal obligation as well as a regulatory obligation to make sure it's secured end to end. So encryption was vital, was really a prerequisite. The second was multi-platform support. So while we can control the devices that our employees use, a lot of time they're engaging with folks outside of their four walls, and we can't control those devices. Similarly, we wanted to be able to support our clinical staff that had personal devices that were in our healthcare setting so that they could engage in that secured texting solution as well. So strong multi-platform support, Windows, Mac OS, Android, Apple iOS was critical for us. The third goes back to maybe Eric's note on happiness, was the pricing piece. The fact that they have a basic license that you can deploy for no cost, in addition to pro and then additional licenses, would allow us to essentially make chat available without the third party we were engaging with, whether that was a physician or an external operations team from a hospital, essentially at no cost. And so there wasn't the cost barrier to getting these folks to come into our chat universe, if you will, and allow them to interact with us. And then the last is, and I know you've experienced this yourself, sometimes you start a conversation over chat, you're talking, going away, and it's like, this would just be easier if we could just get together, if you will, on video really quick in a meeting. And so that seamless integration between chat and meeting was also very key for us.
That's amazing. And I'm sure there was a lot of interesting and important conversations that happened both in Zoom chat and over video conferencing during your meetings. Is there any one that stands out, that memorable conversation that you could share with the audience, maybe?
I think, I think the one I would highlight just because it's timely and, there was situation obviously very recently with the hurricanes in Texas and then in Florida. Maybe talk a little bit about Irma in Florida. We have 9 nursing homes and 80 therapy gyms in the state of Florida. And, so obviously a very difficult time for folks as the hurricane came in and all the fundamental infrastructure in that most of that state just crumbled, as you know. Power was out for, in some cases, a week. Telecommunications were down. And so one of the things that we engaged, because we obviously had Zoom deployed already, we deployed on every single one of our devices in the company, is we said, let's use Zoom group chat as a way for the frontline team on the ground in Florida, worried about the safety of our patients and their safety of their families, to engage around what was happening that moment and how we could be responsive to them relative to the care they were providing to that patient team. So invaluable. I mean, you can't imagine, maybe you can, and I'm sure a few folks in the audience can, but where you have people on dialysis and the dialysis business is closed. You have people that need medical supplies and they won't send the trucks. And so these were just life-altering decisions every moment, and Zoom chat allowed us to stay connected and engage with the people on the ground to help them be successful. And so the good news, we didn't have any significant patient events occur during that event. So, and I think Zoom chat helped us quite a bit there.
That's an incredible story. So you have a question?
Yeah.
Kind of two-part question.
Okay.
How do you manage and govern PHI and PI information? Mm-hmm. And how do you tie it into e-discovery for data retention purposes,
sure,
legal purposes, et cetera?
Yep, great question. Well, obviously, I mean, everything we do is electronic, patient information. So, and so we start with everything that we touch related to patient information is encrypted. And it doesn't matter if it's on a phone, a mobile device, a tablet, in our data center, through channels where we communicate information to others, or in this case in chat. I mean, everything's encrypted. That's the first thing. It's your sort of first line of defense. And we've been very aggressive there. I mean, initially when the HIPAA regulations came out, they weren't explicit about encryption, but we've always encrypted everything. I think relative to retention and such. Our legal counsel has taken chat to be the equivalent of phone calls. Okay, and so in which case, we're not retaining those. In some ways, we don't want to retain them. It's just no different than if I was talking with you and we were chatting over a phone line. We're not recording that voice communication that's happening. And so in our business, we're not recording, if you will, the chat conversation that's happening as well. Now, what's different about chat is if there's, let's say, a lawsuit that's brought, which requires you to do a document hold, then we do hold the chat that's local, that's now stored on the individual devices. We do hold that in line with the document retention requirements. But normally we just, we treat it like a voice conversation.
Yeah,
great question.
It's a great question, thank you. And is there any other best practices that you'd like to share with the audience as far as using Zoom chat?
Well, I think maybe the first one, I'm sure there's other Zoom customers here. So, for us, as we implemented Zoom, and again, for us, Zoom was sort of the go-to platform for everything. So as we were deploying it, in our business, a lot of folks, even though we went through the orientations, we went through the training, and we went through the communications, a lot of people said, well, Zoom means replacement for Adobe Connect. So it's going to replace web conferencing. And so surprisingly, even though people were oriented towards the chat being inside the product and being available, required us to actually do a lot of special communication around chat because everybody sort of just equated, Zoom to, if you will, an Adobe Connect, sunsetting. And the other thing that surprised me a little bit is a lot of folks got sort of the one-to-one Zoom chat, but not the group chat. And so again, just one thing, if you're gonna roll it out, make sure you really highlight the chat feature. People that have used it in our business love it, and it's just that they miss it. They miss it the first 6 times you tell them, and so you just got to keep telling them and show them some real-world examples. The second is we're very large now. We have about 50,000 account holders on Zoom, and so initially when we set up Zoom chat, we had one large chat group of 50,000 people. And you can imagine it trying to sync and retain the present status of 50,000 people on every device that's connected. So that was a little bit of a challenge. So we very quickly, by integrating it to our HR system, we were able to automatically create Zoom groups that were based on that person's business and where they're located and where they operate, so that their default group, if you will, would be the one that was closest to them and made more sense for them to be in. So there's maybe 2 points of advice there.
Yeah, we have some more questions from the audience.
So were any of those groups containing multiple Active Directory domains? Did you have any issues with that? I currently am struggling with that in Jabber right now.
Yeah, we just have one Active Directory domain, and because a lot of our medical record systems are internally hosted, it's also our primary authentication model for almost everything we do. We just have a very large domain, that's all.
Rich, any challenges with driving user adoption? Did you have a strategy going in when you were putting it on every device?
Well, the first is we reached out to Biata and said, what did you do and what could we do as we implemented it, and just wanted to put a little shout out to Biata. They were there first, and they gave us great counsel as we were planning our implementation plan. But no, I think we had an overall plan that mapped the whole services. We took some of the smaller services away first. We were using a little bit of Skype for Business for chatting. We transitioned that out within the first 90 days. Similarly, I think in the first 30 days, actually, we transitioned out video because, again, it just wasn't successful for us. And then we started down, if you will, working on the more aggressive services for us, at least, which was things like replacing Adobe Connect and AT&T. At this point, Adobe Connect's largely gone, and AT&T's down to a very small, small group of participants still. So we're largely on an integrated platform as a business today. Last month, we ran about 10,000 meetings across the enterprise.
I have a bit of a follow-up question.
Okay.
What is your argument to those users that absolutely do not want to switch?
The only thing I can tell you is one of the things that surprised us, I sort of already admitted that we didn't know what Zoom was when we first started our evaluation, and And as we were going through the evaluation, we learned more about, constantly the competitors as well as Zoom. We got really excited about Zoom. It was sort of, I'd characterize it as a little bit the dark horse that sort of nobody expected to mature in the evaluation process, but did. But where it really made a difference is near the end. We took a couple solutions. Obviously we had a couple solutions in-house already, but we actually brought some in and ran them through pilot groups with our real customers, with our clinicians. And so we put it into real use. And there was no doubt what came out of that use. So my recommendation, if you're not a Zoom customer and you're thinking about it, is just get to the point where you get your real folks that have to use your product involved, and then get it into real use, because that's where it really shined, to be honest. That's where Zoom went from being maybe a little bit better to being like, wow, this is the difference. Because what good is a collaboration platform if people aren't using it, right? So again, that was a big sort of aha moment for us as we were finishing up our evaluation.
Thank you. We have
Yeah.
more questions from the audience. Great.
You mentioned you transitioned out of Skype for Business, so I'm interested to know what were some of the challenges you had with Skype for Business, and how did Zoom actually solve your problems?
Well, I think the big thing for us, again, it goes back to that sort of commitment to try to get to one collaborative platform. We had a lot of clinical folks. Again, we're a clinical business, right? So we have nurses and therapists and social workers, right? These aren't IT experts that need to traverse through these different use cases. One might be chat, but another one's a meeting that they've established, that they're coordinating, a webinar. A company of our scale, even if we just take the 2 leaders from every location, we have a meeting of 3,000 people, just the 2 leaders. So it was very critical for us that we could sort of transition through these use cases and do so in a very easy, seamless way. And Zoom allowed us to do that. And at least at the time when we evaluated it, which was late last year, really no other solution allowed us to do that. Because that's where we wanted to be. We wanted to get to the point where our clinicians, our workforce could really engage in these collaboration tools with little or no effort. I think frictionless was used earlier today. I think that's a good verb for that.
Hi. We currently we are Zoom customers, and we use it for audio-video conferencing. But we have a different solution that we use for chat, so for internal and external chat. So I want to. So my question is, did you use any legacy system for chat that you transitioned before Zoom chat?
Well, I think one, we had a population on Skype for Business that was used for chat. That's certainly one. I think the second one, and probably the more entrenched, is that in our business, half of the devices that our clinical team uses are Apple devices. So we use iPads extensively through our business because, again, our workforce is mobile. That's what, right? They're caring for patients. They're with the patients in the rooms around the facility. So we needed mobile technology to support their clinical needs. So a lot of them were using Apple Messages as a way of engaging around that. The challenge is, if I'm engaging with someone in the company, and if I could assume that for a minute maybe they are on Apple Messages, and so, well, that's encrypted end-to-end. But the minute I go to somebody outside the company and they're on an Android device, my session's no longer encrypted. And again, back to the points that were made earlier, we need to encrypt everything end-to-end on any device that we use. So we've been aggressively moving to make sure that we get the staff to stop using Apple Messages, not because I don't think it's a great product in personal life. It's just that it doesn't have a place in healthcare because we can't control the endpoints. Okay, and we've got to be able to control the endpoints. The second thing is, you can imagine, if you're a healthcare provider, is the individual controls their Apple account. So as people come in and out of your company, you can't control what happens to that account and whatever information's in that account as well. So again, being in an ecosystem within chat or texting that allows you to control it is really, really critical for us as well. Yes.
Yes, it's encrypted
Yes.
end-to-end.
End-to-end. Yep. Vital. Yes, go ahead.
Just a quick question. Rich, when you guys decided to roll out Zoom as a collaboration platform across your enterprise, especially introduction of chat, do you have to make any significant changes to your acceptable use? How do you roll that out to your employees? Do they have to re-accept the policies that you already have established, or did it fall in line with what you already had?
I would say largely we didn't radically change our policies. We do have obviously a security policy that encompasses really all the use of systems and services within the company. And I wouldn't say there was a radical shift in that because again, we already had things like Skype for Business, so texting and chat was already embedded in that policy. I think we did emphasize some use cases in the training and education, for two reasons. One, we wanted to make sure they could connect to it, because while, try to think of a good example, meetings is really obvious because people did meetings. Even chat was fairly obvious because everybody uses chat in their day-to-day life. But telepractice isn't necessarily obvious. And so we had a lot of use cases that we built into our training and our rollout and our orientation to help people understand the different uses and how they could be applied. So if I'm in Wyoming, bad example maybe, if I'm in Montana, I like Montana. If I'm in Montana and I'm caring for a patient around a wound that's severe, but the wound specialist I really want to tap is in Pennsylvania. So the question is how do I bring that expert, whether that be a physician or another wound specialist, how do I bring them patient side, bedside, with me in Montana? And again, that was a use case we didn't support before. And so we spent a lot of time around those kinds of use cases to help people understand how this could now be leveraged to provide better care. So, yeah. Sorry.
He pointed at me. I didn't mean to.
Oh, sorry.
Can you walk through sort of a nuts and bolts starting from the day how you would be using messaging? Like, does everybody have to log in the morning? How do they get notified of new messages?
Okay.
How does it work just kind of in the practicalities?
Okay, great. So I think, we talked about this a little earlier in terms of at least alluded to it a little earlier in terms of our footprint. So about half our devices are Windows-based devices, portables or desktops, various spread throughout the organization. And on top of that, about 50% are Apple mobile devices. So we use, on the Apple mobile devices, we use an MDM called Mobile Iron, mobile device management product, where we've automatically added Zoom to the store so they can get auto-deployed down to the clients. In addition to that, on the Windows side, we auto-deploy Zoom to every client. And we set everyone up with a basic license by default. So essentially, every one of our devices is, if you will, Zoom-enabled. So it's available and accessible to every employee that has a device. And it's on those devices that are shared devices as well. So that's sort of the first thing. Trying to think to the second part. So the only sort of non-managed devices for us, at least at this point, even though they are all encrypted, are things like the Macs. We don't have a lot of Macs today. And some of our biggest users are actually Mac users. So we haven't had a problem really with them sort of being connected and enabled and visible. So I don't know, did I miss a part? I feel like I missed a part of your question.
Notifications. We're just getting started.
Yeah, the notifications just come right. You can configure them both on the mobile platform as well as on the Windows and Mac platform. You can control how the notifications are made. But by default, they're enabled, and you'll see them just like when you get an email in, the notifications will come up. You'll get a notification that says, exactly. Mm-hmm.
And for authentication, you can mix both the basic and the advanced plans?
Yes, yes. Really, really, really critical for us. So, and so the way we've thought about it, and again, I just really thank Eric and the team for thinking about it that way, is we can enable our business on Zoom in concept at no cost. And then we can upgrade those that need the more advanced capabilities, whether they need to be able to, for example, hold a meeting for more than 40 minutes, or if they need to do webinars with 300, 500, 1,000 or more, we can essentially enable them by upgrading their account, if you will, to Pro, and then these added features on top of that. So that was really key to us, that we could enable our business. And the way they've positioned the product has allowed us to do that. Really important, yeah. Yep.
You mentioned about strong security. Do you use on-premise solution or you use cloud solution?
I'll be honest. A great question again. When we started to look and do an evaluation, we thought on-prem was really important for us, I'll be honest. And because we do on-prem for almost everything else. Like I said, all of our medical record systems, our HR systems, et cetera, are all on-prem. And the closer we got and then started to work on implementation and planning, and some of the scalability we needed, like I said, it's very easy for us to go just, hey, we're doing a meeting in an hour and we need 3,000 people on it. And so we started dealing with the reality of it. We did on-prem and tried to really keep it on-prem. How do we scale for the kind of volume and utilization that we would need? And we realized that just wasn't practical. I mean, we have to build this enormous farm for Zoom in order to try to maintain the flexibility that Zoom gives us and the capacity that we would need and maintain it on-prem. So we fundamentally then implemented it as a cloud-based solution with Zoom because they handle all that. We have the option, we have an on-prem server. So if there are special circumstances where we need to do that, we will. But so far we've been running in the cloud and been very pleased with how it's been working for us. Yep. Well, whatever. I'm sorry. I think whatever. I shouldn't point. I'm sorry. It's not my pay grade.
You mentioned you still had some holdout with AT&T bridging. What's the reason for that? Is that a technical limitation? Is there some use case they're addressing, or?
Change. I was talking to somebody else about this earlier. Change is hard. Yeah, okay. God, it's hard. And I think that for all the technologies we've used that we're displacing, AT&T audio conferencing and Adobe Connect were just so embedded. I mean, 15 years of just being embedded in the culture of the company, and so those have been the hardest to get rid of. I think right now we're down to less than 5%, maybe 3% AT&T still remaining, and so it's I think we'll get to zero. I have no doubt. And I'll be honest, the AT&T savings is funding Zoom, so there was a motivation there as well. But again, it's all about change management and in some cases hand-holding groups or teams or individuals to make the change. I think our business has been thrilled once they get through that transformation, but in some cases it takes a while. But that's, like I said, we're almost entirely there at this point. Mm-hmm.
One of the hottest names now in the chat applications is Slack.
Yes.
Did you compare Zoom chat to Slack?
Yeah, comparison of Slack. We didn't look at Slack, so I really shouldn't do that. I'll just make a mess of it. So no, I don't know if anybody else wants to speak to that who has looked at Zoom versus Slack, but I haven't. Sorry.
I'm interested in the same thing too, because we have both, so I haven't started Slack yet.
So question to you, considering other messaging solutions, what are the things that are important to you in the solution, in the evaluation? And maybe Rich can speak to that. What is the criteria that you use to evaluate messaging solutions for your company? Sorry, 1 second.
Yeah, not only easy to use, but also integration of other impromptu folks. I know this goes against that whole encryption thing, because we want everything encrypted too, in terms when we're doing DevOps and stuff. But definitely, we got Slack because it integrates with Zoom, but at the same time, most of my dev people are going, and my operations people are going towards Slack now because they were using Zoom chat. Now they're going towards Slack, which is kind of weird. It's kind of weird, but I don't know. So I was here to see if you guys were talking about the Slack and Zoom chat.
No, unfortunately,
integration.
sorry. Yeah,
Okay.
haven't done that. Sorry.
Thanks.
Yeah.
I think this is a common theme we hear from our customers, that they want everything in one place. That's just, there's so much cognitive load that it causes, people to switch from one application to another application to another application. And I need to send a message, and I need to make a phone call, and then I need to start the video chat. Which application do I go to, right? And if you consider how many people you interact through your workday and how many times you need to make that decision, that just becomes unbearable. So that's we hear that from customers a lot, from our users, and honestly, this is one of the biggest reasons what's driving building that product out is essentially giving our customers that choice to have all in one. If you want to make a video call, you can start it within the Zoom application. If you want to send a message, a quick message, or if you want to have a longer conversation, you can do it within one interface. And also, we're adding audio calling as well. So it's literally kind of a no-brainer. There's one solution for all your communication needs, essentially. And later this afternoon, you will see, so my boss, Odette Gal, will present some of the exciting new features that are coming for Zoom. And hopefully you'll be able to attend. And you'll see that we invest in a lot in the solution. And we're adding a lot of amazing features. And hopefully that will entice our users to stay within one application.
Yeah, one of the things that we're interested in, and we've spoken with Eric in the past about it, and I know he's made some progress on integration with Epic, which is a hospital-based medical record system. And so one of the things we're focusing on the integration is sort of not so much to another chat service, if you will, but more into the medical record system, so that as our clinicians are providing care from moment to moment, day to day, that chat's as easily accessible from the medical record system as it is as if you will, a collaboration suite. So the API is there, which is good news. We're still trying to get, quite honestly, our medical record vendors to sign up. Obviously, Zoom's more than willing to help support that integration, but that's sort of the next integration. That next step, we want things like chat and meeting to go, which is integrating it right into the workplace of where our clinicians spend most of their day, which is inside the medical record system.
And which is exactly where our product is going. We're expanding our platforms, and you're going to be seeing a lot of new integrations and a lot of new features coming in Zoom Chat. So what we have today is really 1.0. And there's a long roadmap ahead. So, yep.
Yeah.
Can you send documents through chat? Okay.
Yeah.
And then are they HIPAA compliant?
Not yet. Not yet. They're encrypted, however. So if you can absolutely have a peace of mind, just send something and it'll be safe. And the other things that are amazing, actually, within our chat is that you can start a video call right there and then. And if you need to share a file or share your screen, take a screenshot, you can do it while you're talking to somebody face-to-face or video meeting. So a lot of these little things that make communication more seamless and just easy. That's kind of our goal, where we're going with the product.
Is it possible for you to show what you were just talking about? An example of sharing documents and such through chat?
So how many of you have a Zoom app on your phone? So there's a small tab on the Zoom app. If you open it, there's a tab called Chat. And that's essentially where you would do it. You'd need to go through a few steps to allow, basically, this is my teammate. So he'll, thank you. So it's actually very easy to start. Maybe could you share your experience? What was your first time user experience when you opened Zoom Chat? How intuitive or easy was it for you to navigate?
Well, I'm an IT person, so even if it wasn't intuitive, I'll figure it out. I think the more important thing is that I'm going to pick on our chief nursing officer, who's Joanne Reifsnyder. And the first time she both used chat as well as used meetings on her own, she was astounded. This was actually during the evaluation process, because she had some use cases that our current technology couldn't support. And so, said, what the heck, let's just get her exposed during our evaluation process. And she was just amazed that she could, get into the product, collaborate around it, share her screen, bring others in. She could invite others, and she never required training and orientation or anything else. She could just find her way. And she came out of that first sort of brief session just sort of amazed that there's technology that was this fluid and this easy to use. So again, that's part of what helped us as we got our clinicians in front of the product, really help us move forward with Zoom. So.
Yeah, and I could add to that, simplicity is one of our values, our product values. When we build our products, we think about our users and some patients who are in acute pain. We think about some students who are learning maybe technology for the first time. And we want to build a product that's super easy to use and super intuitive. And that's essentially, hopefully, what you will see with Zoom, how easy it is to start a meeting. And we call it one click. Start a meeting in one click and have a very smart meeting, effective, and no need to go through all the hurdles, dialing in, dialing out, and starting that meeting. The goal is to start it really quickly and efficiently. And the same principle applies to chat, how easy it is to actually add somebody to the group or start a new conversation. So I think there's a lot of benefit to that.
And the only thing else I'll add too, this came true during the evaluation process, but also post-implement. One of the things that's been exciting in working with the Zoom team is just their continued commitment to both product innovation as well as evolution of the product. And I'm sure many of you can probably share suppliers that you've been with where it just feels like it's just not getting the attention that it needs, or maybe every year they change their strategy slightly in a way that maybe is not in your best interest of your business. And so we've just been very excited about the sort of constant level of focus here. When I first talked with Mila, which is, believe it or not, only 2 weeks ago, and she was sharing sort of the commitment around extending the chat program. We were thrilled about that. So again, I'm not sure if you had similar experiences that I had with some of our software partners in the past where it just didn't seem like they were committed in the same direction as your business, but we've been very pleased with Zoom's presence there. I think on the learning side, we were one of the folks last year that said, you talk to Eric and he says he wants to make the product so simple that you don't need any training. So one of the things that we were challenged with as we were implementing was there's no training materials. So we were one of the folks that said, Eric, I understand the product strategy is to make it easy enough that you don't need education and training, but we really would rather have you build really effective training instead of us build it for you, for our constituents. So we were thrilled that they decided to then take that and build some professional training as well. And again, we think that's great. Again, just being responsive again to the needs of the customers. So, but I would tell you his philosophy is you don't need it.
Hopefully you don't. And if you do, we
exactly.
have an amazing support team that's, always on.
Yeah, so.
Any other questions? We do actually have a slide for questions. So you guys, so to those in the audience who are debating or still have some concerns, what would be your advice as far as Zoom chat goes?
I just probably say what I already said earlier, which is get your end customers involved in looking at it and get them using it. Our experience is that's where it really you can do your evaluation matrices and do your conference room pilots, as I call them. But the real changer for us was getting clinicians involved and getting their direct feedback and input in terms of which products really allowed them to be effective and efficient collaborators within their business. So that's really my closing message probably on that is just get the real end users in your business involved in the process, and I think you'll see a difference.
Well, thank you so much. And on a personal level, I want to thank you, especially for sharing your story about Hurricane Irma and how the staff was communicating with each other. It makes it, when you put things like building a chat product in perspective in the real world, it makes it so much more meaningful and it makes it so much more rewarding. So, hopefully we'll, ship a lot more awesome features that your team will enjoy and your patients will enjoy. And I ask you guys to give it a try.
Yeah, thanks for
Thank
spending some time with us this morning. Appreciate it.